everybody who's joining in right now. I want to thank you for taking a little bit of time out of your day and to join us as we talk about this COVID-19. I know that a lot of you already have a lot of information. You guys watch the news, as well as I do. But sometimes you just want to take a break from, your normal, avenues of information and just want to have something a little bit different. So I reached out to the University of Michigan, and we tried to put this together with Dr. Jeffrey Desmond to just kind of, I guess, recap, for those of you who've already heard enough, but you want to hear a little bit more, you want to kind of go over it and just get a better feel for what's happening. I'll probably ask some questions that you've already asked, already have answers to. Maybe there'll be a couple that you don't have answers to. And we'll just do it like that. This is just another form of information, just trying to be factual about what's going on. So again, we have Dr. Jeffrey Desmond with Michigan Medicine. He's the Chief Medical Officer with Michigan Medicine. And what I would like to do, Dr. Jeffrey, is I would just like you to, introduce yourself and kind of tell people who you are and what you do within Michigan Medicine.
Yeah, well, thank you very much, Charles. This is a great opportunity. It's an honor to meet you, and I'm happy to be here. So I'm Jeff Desmond. I'm the Chief Medical Officer for the University of Michigan Health System. I'm actually an emergency physician, so I do my clinical practice in the emergency department. But really, for the last 3 or 4 weeks, I've been coordinating and leading our command center as we have been working on our response to this COVID pandemic and what's been happening in Michigan. I think people have seen the statistics that the U.S. is now the top country in the world with the number of COVID patients. Michigan as a state is number 3 in the country, and the Detroit area is certainly the highest area in Michigan. So we're in Ann Arbor on the western side of that Detroit area, and so we're starting to see a number of those patients as well. So I'd be happy to answer any questions. And I think it's a great opportunity, Charles, for you to do this, to get information out to people. And so I thank you for doing that. I think I heard that Steph Curry did something kind of similar, and he had Anthony Fauci, but you've got me, so I'll do the best I can.
We got you. We got the best. Leaders and best, baby. Well, we just, just to kind of go over, I guess, a little recap, for everybody. Exactly, Doctor, what is COVID-19? And we know the letters COVID and the numbers 19. What is COVID-19 and what do those letters stand for?
Yeah, so it is a novel coronavirus, and COVID-19, it started in 2019, so that's been the name that's been given to this coronavirus. Coronavirus is a respiratory virus. There are a number of coronaviruses. The common cold is a coronavirus, so this is a virus like a respiratory virus, like the cold, but it's different in that it's new, and we believe that this virus first started with transmission from an animal source to humans in Wuhan, China, and then has spread around the world. And so there are, as I said, there are lots of respiratory viruses. This is a novel virus. This happens occasionally. You might have heard of SARS or MERS, or also novel viruses when they jumped from really animal hosts to humans. And when humans have not had exposure to that, then they're at particular risk for this spreading around the world and for people having significant complications from it.
And so when you say new, you're just talking about because of how it originated, but you're not talking about a new, virus completely, because I think, when people hear, new, if you look in your kitchen cabinet and you see some of your household cleaning agents, it may say it fights against coronavirus, but you're saying this is a new virus, but it's been around, but it's just admitted to humans.
Correct. Yeah, new to humans. Yep.
Okay, and so with the coronavirus, as far as symptoms are concerned, what are the symptoms of coronavirus?
Yeah, so for COVID-19, the classic symptoms and the 3 things that we really look for that are most common are fever, cough, and shortness of breath. And so those are really the screening symptoms for that. And we look for patients that have 2 of the 3, because common cold and other respiratory viruses can cause some of these other symptoms, nasal congestion or a little bit of cough. But if you're having fever, cough, and shortness of breath, then that makes us particularly in areas where we know there is spread of coronavirus, makes us worried that that could be coronavirus. Now, there's a couple of additional symptoms that people are starting to describe that weren't described as well early on with the coronavirus outbreak. And those are things like diarrhea and nausea and vomiting, some gastrointestinal symptoms. So not clear exactly how many people have that, but we're starting to see increasing reports of that, people having diarrhea with coronavirus. And then the other one I think that there is some information in the press about is anosmia, or meaning people lose their sense of smell. And so we're starting to see reports of that. Again, one of the hard things about having a new pandemic like this, a new disease that's taking place in humans, is you want to do a lot of science, and you want to have a lot of numbers and a lot of analysis to understand, how prevalent are these symptoms. And we're so early on in this that we don't know exactly how prevalent some of those other symptoms are, but we do know that fever, cough, shortness of breath are the ones that we're particularly concerned about.
Now, those symptoms, they sound a lot like the flu. So for most of the people who are listening here, at some point in your life, you've gotten the flu, you've had those symptoms, fever, cough or whatnot. You go to your local drugstore, you get something over the counter. So if I get, one or two of those symptoms, do I initially treat this as the flu? Do I go through my normal routine? Or should I immediately, go get tested because it could be the coronavirus?
Yeah, so what we would recommend is that you contact your primary care doctor or your medical, medical contact if you're having symptoms. Now we know that probably 80% or more of people may have mild symptoms, so not everybody needs to come to the hospital, and we're certainly encouraging people that they shouldn't just come racing to the emergency department because they have symptoms. Things that should bring you to the emergency department is if you're having trouble breathing, you're feeling particularly short of breath, maybe you're not being able to keep up with fluids and you're becoming dehydrated, those things that we would actually provide some care for in the emergency department. But for mild symptoms, people should stay home. They should separate themselves from others in case they have this and don't want to spread it. And they can talk to their doctor to see if they meet criteria to be tested. I think you may have heard there's a lot of, there have been challenges with having enough testing available for everybody that wants a test. So we're really testing people that have symptoms and enough symptoms that would require them being tested.
So to be clear, you are not recommending that everyone just go get tested just to clear themselves of the coronavirus. They should stay at home. If they get any symptoms, then they should quarantine themselves as you suggested. So do not just go out and get tested.
Yeah, and that's driven a lot because we just don't have the testing supplies to test everyone. And I think as we catch up with the pandemic and we have more testing supplies and tests available, then we would broaden that testing to those where it would really make a difference and would change their behavior or change our treatment if we know that they are testing positive. I know there's a lot of fear out there, and we appreciate that because people do become severely ill with this, and it would be great if we could just relieve everyone's concerns by getting a test, but that's not necessarily going to be effective. The other thing in terms of testing asymptomatic people or people who have very minimal symptoms, is we're not exactly sure how well the test might perform in those situations. And you may have symptoms early on, and it may not be coronavirus, and 3 days later you have some more symptoms, and that is coronavirus. You'd have to kind of test people serially to know. So one of the things that people are talking about is a different type of testing. What we've been talking about up to this point has been the nasal swab or the nasopharyngeal swab, a swab that goes in the back of your nose and mouth and gets a sample of your respiratory secretions. And we test that for the actual genetic material of the COVID virus. And that's the test most people are talking about now. You may have heard that there's a blood test or a serology test that looks at people's immune response to the COVID virus, and that test is just coming out. That test on a broader scale may be helpful to tell us who has had coronavirus, whether they've had severe symptoms or not, because what we look for there is the buildup of antibodies that people may have had if they had the virus. So that might be a test.
How is that test performed?
So that's a blood test. You take a small blood sample and they send it to the lab, and the lab can do that test pretty quickly. There are people who are talking about like a point of care or a finger stick test that you could do very quickly in the moment, but those aren't, I think, widely available.
So what do you how do you feel about? I was out, had to go to the store the other day, and you see a lot of people out with masks. What's your recommendation about people being out and about and wearing masks? Should people have on masks when they're out trying to perform whatever duties that they have to do for the day?
Yeah. So I think there's a lot of things that people can do to protect themselves. And some of the basic things that we've talked about: cover your cough, clean your hands frequently, clean hard surfaces. Certainly we know that limiting the amount of time that people are out and limiting how close you are to other people are what we call social distancing. So making sure that people are staying apart from each other so that we're not spreading the virus if someone may have it. Not gathering in large groups. But then I think the other thing that people can do is wear a mask. And the mask does two things. The mask that you're wearing provides you some protection if someone were to cough and to have droplets in the air that may have coronavirus, and prevent you from getting those in your nose and mouth. And that's really how coronavirus is spread. But it also protects others, because if you're wearing a mask and you may have very mild symptoms and you're inadvertently coughing or sneezing, it prevents you from spreading those droplets to others. And so while we said that coronavirus is a new virus to humans, this is spread in a similar fashion to other respiratory viruses, which is really droplet spread. So by coughing, sneezing, respiratory secretions that have large droplets that may travel up to 6 feet in distance. So that's why keeping more than 6 feet apart, not gathering, and wearing masks can be protective.
So my question about the social distancing part is, you talk about those droplets, and when I think about droplets, I think about fires, and you start a fire in one place, and then the embers they get caught up in the wind, and they end up somewhere else. Sometimes great distances away from where the fire started. Now these droplets, they're basically next to nothing, very small droplets. So we say 6 feet being the safe distance, but is 6 feet far enough for these little droplets that can blow away in the wind? Can they get to you no matter where you are, depending on the person coughing or sneezing?
So I think that's a great question. That's a question that comes up in the hospital a lot. And what we know is that the respiratory droplets, when people cough or sneeze, those are actually pretty big droplets. And those things only last in the air for about 6 feet. The other thing that you're talking about, the very fine, small particles that may stay suspended in the air, we call those aerosols. And that's things that can stay suspended in the air for some period of time. It usually takes something more than coughing or sneezing to create a significant amount of aerosols. We worry about that with particular medical procedures, when people are doing procedures on the airway or using suction devices or those kind of things. And that's why we use the N95, the particular form-fitting mask that filters out those particles during those procedures.
Now, when we talk about, people being in their home and being sick, I think the hard part for folks is that, there's a lot of people out here with families. I always think about single mothers, because my mother was a single parent. You got children at home, sometimes very young children, and the parent gets sick, and all of a sudden that parent is supposed to self-quarantine. What advice are you giving people who are in a home like that, and the parent is sick and has to, kind of set themselves in one part of the house in a room or whatnot, to not get their children sick? What kind of advice are you giving those families that are going through those tough times?
Yeah, those are hard times, and we appreciate that. And it is very challenging sometimes for people to socially distance and to manage that at home. We also feel that in the hospital, when we've had visitor restrictions and we're not allowing visitors to come to the hospital. So our advice in that situation is really to do the best you can. I think wearing a mask and reducing the droplet spread, frequent hand hygiene, cleaning hard surfaces. So we know that the virus will probably last on hard surfaces longer than cloth or textiles or soft surfaces. So making sure you have adequate cleaning supplies and are able to do that fairly frequently. Not sharing utensils, not having close contact. So, if a mom had to feed her child, to wear a mask, to stay some distance apart, but then to really practice good hygiene in between those things. But it is a difficult situation.
Now in Michigan, you talked earlier, there's been an uptick in cases and in deaths. I think the last time I looked, there was, I believe, like around 845 deaths and 20,000 cases. You know, what can you attribute that to, in the state of Michigan and all of these new cases and the people that are dying?
Yeah, so I don't know that we really know exactly why certain areas are harder hit. I think we're starting to see some evidence around comorbid conditions, people that have more medical problems, high blood pressure, diabetes, lung problems, heart problems, and that there is a higher rate of complications in those individuals. This is kind of speculation on my part, but I think Detroit being close to an international airport, being a fairly consolidated, there's a large number of people in a small space. I think you saw that in New York City and other places. And I think there may be some things that make it hard for people to socially distance. Now, Michigan was early on in having a stay safe and stay at home legislation by the governor to keep people at home. And we've seen in areas where people have had a greater opportunity to stay home, we've seen a slowing of the spread of the disease for sure. And so we're starting to see that in the Detroit area and in the western area of Detroit now as well. We're starting to see a slowing of that spread. And the way we measure that is something called the doubling time, which is, how many days it takes for the number of cases to double. And early on, we were seeing cases double about every 2 or 3 days. Certainly looks like that's slowed down considerably. So we're seeing a slowing of that spread.
Now, I know, testing is paramount right now, especially, we're talking about Michigan. How readily available is the testing in Michigan, and where do people go to get tested?
So for almost every health system in Michigan now, people have set up hotlines. So you can call your doctor or you can call the health system and they can do screening questions and determine if you need a test, and they can route you to a testing site. Michigan Medicine has stood up our own testing, and so we have significant testing capacity here at the hospital, and we're providing testing for some other regional hospitals as well. One of the challenges about the testing is just the testing supplies, the tube and the medium, and then also the swab. And that's really why we're still focusing on testing those patients that are symptomatic or at our highest risk of complications. So patients that are coming into the emergency department and need to be admitted to the hospital, or patients in which the test is really going to change the care we provide for them.
And so, talking about the testing, the other big thing is ventilators. I think since the onset of the coronavirus, ventilators has been, at the top of the hill, I guess, so to speak, as far as what's needed. Tell me why ventilators are so important right now in the fight against coronavirus, and also where's Michigan as far as ventilators and having enough ventilators to supply for the people who need it?
Yeah, so it's a great question. And this is one of the reasons why the coronavirus is different than other respiratory viruses, is because it particularly seems to cause pneumonia. And pneumonia is when you get consolidation in the lungs, fluid in the lungs that builds up from the virus infection in the lungs and makes the lungs not function well, so that people don't get enough oxygen. And that's why they feel short of breath with this. We can provide additional oxygen through face masks or through nasal cannula and some new devices that can really provide a lot of oxygen. But when that fails, what we need to do is put people on a ventilator. And that's when we put a breathing tube in their trachea, the airway tube, and then we put them on a machine that basically breathes for them. It allows us to do a couple things: provide higher levels of oxygen, and also to adjust how we ventilate them and the pressures in their lungs to be able to provide more oxygen to them and have their body use that oxygen in a better way. So ventilators become a critical thing for those that are critically ill with coronavirus. And we see it more often in elderly people, more often in people that have risk factors for complications. And we talked about some of those comorbid conditions, other medical problems that you have. But it's interesting, and we're seeing some young, healthy people that become rapidly ill and require ventilators as well. So in terms of Michigan Medicine, we're actually well set for ventilators. we have expanded our ICU, our intensive care unit capacity here, almost double now, as we've taken areas that are not usually used for intensive care space and expanded that so we can offer intensive care to a larger number of patients. And we still have enough ventilators to be able to do that. Now, I think you're hearing different stories in different parts of the country, particularly New York, where I think there were significant shortages of ventilators. But for right now, Michigan Medicine is set well for ventilators.
What role does pre-existing conditions, i.e. diabetes or asthma, what role do they play in, whether making this a more deadlier disease or making it harder to deal with? What role do they play?
Yeah, so they play a big role. And I think what we know is that diabetes, heart disease, significant lung disease, obesity seem to be risk factors that may put you at higher risk for complications, needing a ventilator, or not being able to survive even with a ventilator. So we know that those things matter. I think the other thing that's important is people that would have other diseases that would make them at risk for complications of being on a ventilator. Certainly with coronavirus, those things are like that as well. So severe asthma, if you had COPD and required oxygen at home, some of those things aren't necessarily called out, I think, in some of the CDC risk factors, but certainly we know that those are risk factors for people. If they required a ventilator, would be either harder to ventilate them or they would be at higher risk for complications. And so we think about those things when we look at people as well.
To your knowledge, right now, there's been different things floating around, but to your knowledge, is there any drug out there right now that fights against Corona-19?
Yeah, so there's no specific treatment for Corona-19. And really the best care that we know of is very good supportive care. And that's very good intensive care and very good pulmonary care with the ventilator and all the things that are associated with that. I think there's been a lot of talk about the drug hydroxychloroquine. And we are not routinely prescribing hydroxychloroquine for our patients. There are situations in which we do think it's valuable and we're using that. But it's a challenging drug to prescribe, and there are complications or side effects from it. And so blanket prescription of hydroxychloroquine is not what we're recommending. But we look at every patient individually and try to tailor that treatment to what that patient needs.
It's going to take a team effort in order for us to, combat against coronavirus 19. So my next question is, how closely does Michigan Medicine work with the Center for Disease Control or the World Health Organization? How much do you guys collaborate? Work with each other, bounce information off of each other? How closely are you guys working with each other?
So I think we're working well with them. We have individuals who have connections to the CDC and to other organizations. But the other thing, and I think it's really important to raise that issue of team, there's been a level of coordination, I think, across our health system and within the state that we've not seen before something like this. And so health systems are trying to help each other out. We've taken transfers of a number of patients from Detroit hospitals when they were either had patients they couldn't care for or too many patients there. So I think people are doing a tremendous amount to do this, to take care of the patients. The other thing is, I think the scientific interchange and the willingness to share information and share treatment protocols is true, not just with the CDC and the WHO, but across countries and across other health systems within the country. So as this started in Seattle early on, people in Seattle were posting information that we were looking at to say, how can we be better planning? How can we be prepared when this comes here? So I think there is a tremendous amount of sharing of information in the medical community.
When you first started talking, when we first got on, you mentioned animals. Again, here's another thing that's been thrown out there widely, across a lot of different outlets. Bats. What role have bats or have not played in the coronavirus?
Yeah, well, I think there is a strong suspicion, and I don't know all the science on this, but I think there's strong suspicion that bats were the original source for the coronavirus, and that this is a virus that existed among bats and it may have jumped from bats to humans as the start of this when it started in Wuhan, China.
And so I guess kind of explain that because are we talking about a bat biting a person? Are we talking about a person eating a bat? Are we talking about a bat biting a pet and that pet giving it, you know, to their owner or to a person somehow? What are we talking about with that?
Yeah, so I don't know that we know exactly, but what likely happened is in some way the virus in the respiratory secretion from a bat came in contact with the person who then became infected. And then that person then starts to become ill, develop fever, cough, shortness of breath, start spreading that virus amongst others. So that's the same way the virus would spread between people. Really, as we said, it's droplet spread. So if you get that respiratory secretion or droplet that has virus in it and you get it in your mouth, your nose, or your eyes, that's going to be how you're going to get that. You're probably not going to get coronavirus from ingesting food that's been cooked where the virus may be inactivated. You're probably not going to get it from contact with clean, dry, unbroken skin, but it really is transmission through the mucous membrane. So the eyes, the nose, the mouth is probably the source of infection.
So you're not going to get it most likely from eating food, but from your pets, there's a possibility?
So I don't know how much of a vector pets would be. I think we've heard some reports that their pets have been infected, but I don't honestly know how reliable that information is or how often pets would be a source of infection. And the one thing I just want to be clear on, if someone coughed onto a plate of food and you ate that, so you expose those respiratory droplets in your mouth, that's certainly a way you're going to get coronavirus or could be transmitted that way. But cooked food, we know that heat and that drying both inactivate the virus. So once the food is cooked, it's probably less risk.
So let's talk about, the doctors, nurses, researchers. How do you go about, really truly protecting those guys? All of these guys are on the front line. We talked about families being in close proximities with their families. Well, doctors and nurses, you're right next to these patients. I mean, how do you guard, these brave men and women from, contracting the virus?
Yeah, well, that's a great question. And we think about that all the time. It's, the safety of our employees is our first priority, really. And we feel very strongly about that. And there's a number of things that we do to keep people safe when they're at work. The first is we've looked at those providers and those employees who may be particularly vulnerable to coronavirus. So elderly or with immunocompromised conditions, or those that we think would have particular complications from coronavirus. And we've asked them not to be on the front lines. So that's one of the things that we've done. The other thing is we've been lucky enough to be able to continue to provide our employees with adequate amounts of personal protective equipment. And so we ask people, as I talked about before, we wear surgical face masks, eye protection, gowns when we go and see those patients. And for any procedure that's going to generate those aerosols, those fine particles that we talk about, we use a special mask called an N95 mask, which is tighter fitting and filters out more of the particulates. And then we have asked people to use face shields as well that can help reduce exposure. And then we've trained people, and we have ongoing training in the putting on and taking off of that equipment, so that if you do get secretions on you, you can take that on and off in a safe way and not expose yourself. But I'll say we have, tremendous respect and gratitude for our employees that are on the front line. We have people show up every day and are here to, take care of those patients, and the dedication and the concern and the compassion that our employees have, both for each other and for the patients they're seeing, is really, that's really the story here. I think that they are the real heroes of this, and we can't thank them enough for everything they do. Recognizing that they may be concerned about these exposures and being at work, we've also offered some housing options for people that either feel like they need to take a break from their family because they're exposed. They may not be infectious, but they just don't feel comfortable going home, or they have someone at home who's particularly at risk. And so we've had housing options here at the university and in local hotels that will where our employees can stay if they don't want to go home.
Now, I talked earlier about going to the store and seeing people with the masks on. Well, I also saw a lot of people with gloves. And when I got home, I told my wife, I said, hey, a lot of people out there with gloves on, that seems like, a smart thing to do. And my wife used to be a nurse, and she was like, no, the gloves aren't effective because you touch everything with the gloves. Can you explain to people why the gloves are not as effective as we think they are?
So probably sanitizing the hard surfaces and deactivating the virus is going to be more effective than wearing gloves. Certainly hand hygiene is important. We wear gowns and gloves when we go in to see patients because that does allow you to keep some of that exposure off, but then we practice very careful hand hygiene when we come out. So we clean our hands very carefully. But thinking that you're just going to wear gloves and that's going to protect you, you could touch that virus, take that glove, scratch your face, scratch your eye, it's going to transmit the same way as if you did that with your hands. So thinking about sanitizing surfaces, good hand hygiene, keeping your hands away from your face if you can, those are going to be things that will protect you more than just the act of wearing gloves.
Have we plateaued, Doc? I know they've been talking about this curve, and are we still climbing, or have we hit the plateau with this virus?
So I think it varies by region, to be quite honest with you. And in many places of the country, they're at different stages in the curve. The country as a whole, I don't think has plateaued from the data that I've seen most recently. And I alluded to this a little bit when we talked about Detroit. We've certainly seen Washtenaw, Livingston County, the county that Ann Arbor is in and nearby, that doubling time has increased. And so we are seeing significant flattening of the curve there. It's a little bit slower in the areas that have had more cases. And I think you're starting to hear some reports out of New York now that they feel like the curve is flattening a little bit. And so I think there are areas in which we are flattening the curve. I worry about those areas that have not really had the stay-at-home order or not as aggressively socially distancing or limiting mobility, because I think that's the biggest factor to reducing that, to flattening that curve and reducing the spread.
Well, Doc, I appreciate your time. I know you have a lot of work to do, but as we conclude today, is there anything that you want to leave us with about what Michigan medicine is doing to fight the coronavirus, or any words of hope that you want to give everyone out there listening? Anything you want to leave us with, you take the time.
Yeah, so I think from Michigan medicine, and this from your time here too, I think that phrase, the team, I think that is really what it's about here at Michigan. We have a tremendous team, and the team is doing a phenomenal amount of work and tremendous efforts in caring for the patients that we're seeing and trying to help both within our region and within the state of Michigan. I think that we can, we will beat this coronavirus thing. We will get through this. I think it's going to be, being careful about social distancing, the things that we've talked about, how we can prevent spread. But really, from the Michigan medicine side, it's gratitude for our employees, as we talked about, and everyone that's doing everything they can. But then the response that we've had from the community, which has been just humbling, I would say. The outpouring of support that we've had personal protective equipment being made by small companies. We've had face shields that are being made by auto companies and donated to hospitals in the region. We have auto companies that are starting to make ventilators. We have people at home that want to make and send masks. So I think this idea of teamwork and collaboration and really the outpouring of support that we've had from the community, we're tremendously grateful for that. And I think that is what's going to get us through this. So I appreciate your efforts in this as well, not only for putting this venue together, but also for everything else you've done for Michigan medicine. And we know that that's been a lot over the years. So we really appreciate that. And thank you.
Thank you. Thank you for all the work you're doing. shout out to all the doctors and the nurses, everyone working with you there at Michigan Medicine, CS Mott Children's Hospital, of course, but everybody who's in this fight together. We're all in it together. Thank you for your time, again, and everything that you're doing. I really appreciate it.
Great. Thank you.
Yep. Thank you. All right. There you have it, man. Just a little conversation with Dr. Jeffrey Desmond at Michigan Medicine. Just trying to help out where I can, man. Just a little information that you guys can use. I hope you learned something, or if it was a recap of something that you already knew, hopefully that helped out too. But I appreciate you guys taking a little bit of time out of your day to join us, and just trying to stay informed, man. You guys be careful out there as best you can. I'm not going to tell you what to do or not to do, but you know what you need to do as an individual and how to take care of your family. So make sure you do that. Much love to everybody out there. Go Blue.